Okay, so my name is Lisa and I work for Garfield County Libraries. Thanks for joining us this evening. Garfield County Libraries has 6 library branches in all towns from Carbondale to Parachute. If you are interested to know more about the library, we'd be delighted if you call us or come in or go to our website to learn more. We received a message last evening from our executive director that libraries have been designated as essential services. So the libraries are open. If we have to make any changes in the types of services or hours that we're open or anything, you would definitely be hearing about that through public service announcements and our website and whatnot, but business as usual right now. We do have a couple other things coming up that I just want to mention really quick. This coming week, we start a 3-week series of some model kits that are for teenagers. So if you have any teens in your household, they can come each Wednesday starting this coming week, the day before Thanksgiving. They will have a kit to build a catapult the first week, a clock, a gear-driven clock the second week, and the third week is it's a helicopter, but it's a very different helicopter. It's a 1500s or 1400s version of a helicopter. So that's some things we have coming up. Also, we're on a break next week for Thanksgiving, but after that, we have some adult craft kits and some children, elementary school children aged craft kits that you can come in and pick up at any of our branches on Thursdays, and these are all free. So wanted to let you know about those events, and also if you know anyone who prefers Spanish to English, this presentation that we're going to have tonight will be happening Monday evening at 6:30 in Spanish. So with that, I would like to introduce Sylvia and Nayeli from Mountain Family Health Centers, and they are going to take us through the presentation this evening about health insurance, the 5 questions, or 5 W's of health insurance, I should say. Thanks, guys.
Thank you, Lisa. Yes, welcome. We're going to talk to you guys today about health insurance, the 5 questions. And my name is Sylvia. I am a health coverage guide with Mountain Family Health Centers. I've been with the company for over 7 years doing this work since the Affordable Care Act passed. I'm glad to be here and give you guys more information.
Hey everybody, my name is Nayeli. I'm also a certified health coverage guide with Mountain Family Health Centers, and this is going to be my 3rd open enrollment, so pretty excited to be here. All right, so we can go ahead and get started. If you guys have any questions, you can feel free to chat in at any time, and we should be getting to those in a timely manner. All right, so our agenda for today, so we're going to talking about a little bit about our organization and our partnership with Connect for Health Colorado and the 5 W's of health insurance. So what is health insurance? Why is it important? When can you purchase your health insurance? Who can purchase the health insurance on the Colorado marketplace, which is Connect for Health Colorado, and where you can get help. So a little bit about Mountain Family. So we established in 1978, and our mission is to provide high quality integrated primary medical, behavioral, and dental care in the communities we serve, with a special consideration for those who are medically underserved, regardless of their ability to pay. So the Outreach and Enrollment Department was created back in 2013 as part of the Affordable Care Act, and we focus on increasing access to medical, dental, and behavioral health services. We assist individuals with applying for state services, state programs, such as Medicaid, Colorado's Marketplace, and we also have internal SLIDE programs that go based off of your household size and income. We participate in community events also, such as like health fairs and stuff like that, to increase awareness of health insurance affordability, programs and the importance of having health insurance. All right, so Connect for Health Colorado has a mission to access affordable plans for individuals and small employers by purchasing health insurance through the marketplace. So Connect for Health Colorado is the only place where Colorado residents can apply for subsidies, such as premium tax credits and cost sharing reductions to lower the cost of your health insurance. There are tools on the website that will help you compare plans side by side, also individual carriers, and you can also search by providers. All qualified health plans on the marketplace cover the 10 essential health benefits, and there's also protections in accordance with the Affordable Care Act. There is a statewide assistance, such as the Customer Service Center with Connect for Health, assisters, and brokers to help individuals find the best health plans that will meet their budgets. So what is health insurance? So health insurance is a contract between you and the health insurance carrier that will help you with some or all of your healthcare costs in exchange for a premium. And your premium would be the amount that you agree to pay to the insurance company, usually on a monthly basis. So why is health insurance important? So health insurance provides financial protection in case you have a serious accident or illness. For example, here we have a broken leg can cost you up to $7,500, and an average of a 3-day hospital stay can average about $30,000. So on here, when we compare them side by side, on your left side, you'll see those who are uninsured. Back to the broken leg example, $7,500, and the 3-day hospital stay comes to a total of $37,500 out of your pocket if you were uninsured. If you were to have insurance, per se, your deductible is $3,000 and your max out-of-pocket cost is $5,500. The total you would pay for this sort of injury and hospital stay would be $5,500. So these are just some of the basic insurance terms that you hear a lot. So premium, again, the amount you pay to your insurance carrier, usually on a monthly basis. A copay is a fixed amount that you will pay per each medical visit or prescription. Coinsurance is the percentage that you have to pay after your deductible is met. Your deductible is the amount you spend before your insurance starts kicking in to help you with those medical bills. And then your max out-of-pocket cost would be the max you would pay out of pocket during your plan year for any medical service or prescription. So why is health insurance important? This takes us back to some of the essential benefits that will be covered under the plan chosen under Connect for Health Colorado. So emergency services are covered, hospitalization, there are services for children, pregnancy, maternity care, prescriptions are going to be under each plan, and mental health, and substance use disorder services. There are also free preventative health care services offered under each plan, such as your annual wellness check, vaccinations, and some screenings for depression, diabetes, hepatitis C. and B, smoking related diseases and certain cancers. And there is no problem if there are pre-existing conditions. So Connect for Health Colorado will not charge you more or refuse to pay for any of the essential health benefits if you have a pre-existing condition when your coverage starts or prior to, and this includes pregnancy. So when can you buy health insurance? Open enrollment started November 1st, and that runs through December 15th in order for your coverage to begin on January 1st of 2021. December 16th through January 15th is a different deadline for your coverage to begin on February 1st. After that period, you cannot enroll in the marketplace. You would be outside of open enrollment. But in case any life-changing event happens, it will open a special enrollment period for you and your household. So some of the life qualifying events would be if you lost your employer-sponsored health insurance, if you were on Medicaid and lost that coverage, if you were married, had a baby, if you moved to the state, or if you are turning 26 and aging out of your parents plan. They will give you a 60-day window prior to the event happening and also afterwards. So who is Connect for Health Colorado for? So if you work for a business that doesn't offer health insurance, you can try to enroll through the marketplace to see if we can get those subsidies in place for you. Those of you who are self-employed, who are in between jobs, if you're working as a contractor, if you're working part-time and you're not eligible for those full-time benefits, or you need help with the cost of health insurance. So how does the financial assistance work? Financial assistance is available for those who qualify. So a premium tax credit is what will lower your monthly premium. And you can also choose to take this at the end of the year. So you don't have to take it on a month by month basis, but at the end of the year when you are filing your taxes. And then cost sharing reductions will also lower your max out-of-pocket costs, your deductibles, your co-pays, and prescriptions. All right, so here is a little graph that'll show us who is eligible for the subsidies. For example, a family of 4 looking at $65,500 annually, you would be eligible for those premium tax credits as well as the cost sharing reductions. Our next little guide here, if you jump up to 65,501 to 104,799, you would be still eligible for the subsidies, just without the cost sharing reduction. So your premium is going to be a lot lower, but your cost sharing reductions just won't be there. And then the max for a family of 4 is $104,800, and you can still qualify for a plan through the marketplace. You would just be purchasing this plan at full price. So where should you apply for health insurance? So again, this brings us back to Connect for Health Colorado. Their website is connectforhealthco.com, and you can get assistance with a sister, a broker, an enrollment center, or you can also contact Connect for Health Colorado customer service directly, and they can now help you over the phone as well. So Mountain Family Health Centers has certified assisters through the marketplace, and we have appointments available in person and virtual. Your preference is perfectly fine. Our locations are Rifle, Glenwood Springs, Basalt, and Edwards. The Mountain Family Clinic in Glenwood Springs is one of our enrollment centers, and we take walk-ins on Mondays and Wednesdays, 8 a.m. through 5 p.m. So just a map of our locations covering the Garfield, Eagle, and Pitkin areas. And then our contact information. So the 945 number gets you to Mountain Family's call center. If you use the 833 number, you will get directly to the enrollment department, and any of our assisters can help you with any questions. And then again, Connect for Health Colorado's phone number if you want to reach the customer service center.
Thank you, Nayeli. I just want to also let everyone know that we are offering some enrollment assistance on Saturdays. We do have some events coming up on December 5th and also on December 12th for Saturday enrollment events, because we do understand that families work during the week. Give us a call and then we can see what date is, what works better for you, virtual or in person, and then what day during the week as well.
Are there any questions?
So I don't see any questions on the chat. If you guys have any questions, we'll hang around for a few minutes. Let us know. We can help answer some of those questions.
Thank you so much, Nayeli and Sylvia. And yes, we'll give just a minute or two here to see if anyone wants to use the chat function to send us a question. But this has been a very helpful and informative presentation about what's going on. And again, you said that people have until December 15, is that correct, to enroll in a plan that would start January 1st?
That's correct. So December 15th is the first deadline, and I believe it's a Tuesday. So let us know, we can help. Like we're doing, like I said, events on the Saturdays as well to make sure everyone that needs insurance gets enrolled and gets the assistance that they need.
And do you advise that people check out Connect for Health Colorado no matter their income level, just to see?
I would say yes. There is a tool called the Plan Cost Comparison or Plan Finder, and they can go on there and shop anonymously. So they can just put in their first name and their year of birth, and then they can see if they're eligible without necessarily submitting an application if they're not ready to do that. So they can go in and look and see, oh, looks like you're eligible for a $300 advanced premium tax credit, and then look at the plan before they actually submit an application.
Okay, great, thank you. And then I see we do have one question in chat for you now.
So to attend an enrollment appointment, as far as if it's the first time that you're going to apply, we will need information from your household, name, date of birth, social security numbers, addresses, and then we also do need your verification of income or an estimated of income, because we're looking at plan year 2021. So we're going to ask you to estimate your income for the upcoming year. And we know that can be hard, but if you bring in any income documentation that you have, we can kind of help you review it and help you estimate what your income could be for 2021. That's basically all you need.
Could I perhaps have you put that last slide back up again with your contact information, Sylvia?
Yes, I was gonna actually type it up in the chat as well, but let me put it up.
Perfect, thank you.
No problem. I'm gonna put our phone number.
Great. So we have a phone number that gets you directly to enrollment at 833-273-6627 or email enrollmenthelp@mountainfamily.org. So I know that those of you who are here right now can see that. I know you can read that, but we're also recording this, so I just wanted to state that for the recording also. So if you know of anyone who will be sorry to have missed the presentation tonight, I believe by next week we will have it available on Garfield County Library's YouTube channel, which you can get to also from our website.
Thank you. Thank you very much, Lisa, and Garfield County Libraries for having us today.
Yes, well, I don't see any other questions coming in, so thank you, Nayeli. Thank you, Sylvia. Thank you to those who joined us this evening, and best of luck to everyone as they're out there looking for health insurance, and have a good and safe weekend. Thanks, guys.
Thank you. Good night.
Good night.